Good afternoon. My name is Don Pope Davis, and I am the Dean of the College of Education and Human Ecology. It is my pleasure to welcome you to this educational opportunity from our college here at The Ohio State University. This annual event is brought to us by our superintendents in residence, John Marschhausen from Hilliard City Schools, Talisa Dixon from Columbus City Schools, and Marie Ward from Fairfield County Educational Service Center. I thank them for their leadership and for organizing this event. Today's topic hits home for many of us as we address multiple crises facing our community and our country. While we have continued our responsibilities during this time, it is increasingly important to recognize signs of stress in our lives and to practice self-care as we lead and engage others through this incredible challenge. Today, we will hear from health experts that can assist us in identifying and addressing stress in our lives, and from leaders who have continued to inspire and enact change through this unprecedented time. Thank you for joining us in this discussion.
Good afternoon. I'm John Marschhausen, and as the superintendent of the Hilliard City Schools, and in my third year as superintendent in residence at Ohio State, welcome to this event that we've put together as we as school leaders have experienced a different level of stress than ever before over the past 12 months. We are approaching a year since schools were shut down on March 13th as the COVID virus rocked our worlds and changed how we all live our daily lives. For this first panel, I'd like to welcome three distinguished faculty members at Ohio State, healthcare professionals, who can talk to us a little bit about how stress impacts us physically and how it affects our families. I'd like to ask each of them to just give a brief introduction, and then we'll jump right into some of our questions with Dr. Melnyk. Dr. Melnyk, if you'd like to go first.
Sure. Thank you, John. And hello, everybody. I'm delighted to be part of this panel this afternoon. I left sunny Arizona 9 years ago to come to Buckeye Nation in Columbus, Ohio. And everybody says, were you out of your mind the day you decided to do that? And I said, absolutely not. I came to pursue a dream as the first chief wellness officer for Ohio State, as well as dean of the College of Nursing.
Thank you. Dr. Mehta, if you'd like to introduce yourself.
Hi, my name is Laxmi Mehta, and I'm a non-invasive cardiologist and section director of Preventative Cardiology and Women's Cardiovascular Health at The Ohio State University. I've also been recently named Vice Chair of Wellness for the Department of Internal Medicine, as wellness has been impacting even the medical community during these COVID times. And I also feel the stress that you all go through because I have a child in high school as well as one in college. So I know the educational needs of having our children back in school. So thank you for having me here today.
Thank you for being here. And Dr. Bartle-Haring, if you could share a little bit about yourself.
Yes, my name is Suzanne Bartle-Haring. I've been at the university now for, I think this is my 29th year. I direct a couple and family therapy program that we have in the college. And in terms of how I hope I can help is talking about how to give yourself some grace while all this stress is going on. So anyway.
Well, thank you. I know that Dr. Melnyk has a national commitment, so we're going to jump into our questions with her first. In your role at Ohio State, and all leaders, education, medical, in many ways, we are all leaders, experience stress. What are the physical signs that we as human beings should be looking for as those warning signs that we're not handling this well? We don't want to have to get to see Dr. Mehta after a heart attack. So what should we be looking for?
And by the way, Dr. Mehta is a fabulous women's cardiologist. She's my cardiologist, so I have to give her a plug. I first want to share that some stress can be positive in our lives. It can help to motivate us. But too much stress, chronic stress, can have a lot of adverse effects. So I'm going to talk first about physical effects, but I also want to talk about emotional, cognitive, and behavioral signs of stress. Of course, you all know yourselves very well. When we get stressed physically, our heart rate goes up, our blood pressure goes up some. We have difficulty sleeping often. But I also want to emphasize that somatic symptoms are very common with chronic stress, including headaches, upset stomach. A lot of people will even have diarrhea with stress. But in addition to that, if you feel yourself really slipping with low energy, that could be another sign of chronic stress. But beyond physical symptoms, we've got to be in tune emotionally. When we get really stressed, it's very common for us to get angry, irritable, to snap at our loved ones a little bit more frequently. It can lead to depression, even social withdrawal. And cognitively, chronic stress can really play havoc with our judgment and our thinking. Constant worrying, our mind racing, forgetfulness is very common if you're really stressed. And then behaviorally, there are also adverse effects. What we're seeing across the country right now, people are trying to cope with COVID with unhealthy behaviors, including overeating, unhealthy eating. In addition to that, there's been a rise in alcohol and drug use as people try to self-medicate their symptoms. And John, if I could have 60 last seconds to ask people to join our mask on, mood up movement, that would be great. We're asking people when you put on your mask to do just 3 things. Take 3 big abdominal deep breaths using the 4-7-8 method. Breathe in for 4 seconds, hold it for 7, exhale slowly for 8. Secondly, be kind to ourselves. Say 10 positive self-affirmations out loud when you get up in the morning. And lastly, be kind to others. Take a daily dose of vitamin G for gratitude. Every day, get up, think of 2 people you're grateful for, and turn around and share that with them. That's going to reduce stress and improve mood.
Thank you so much. We hear people who kind of get in that negative self-talk loop where you get in groups of people who are being negative, and it just kind of snowballs. And that's such great advice. I'd like to introduce my colleague who was just able to join us, Dr. Talisa Dixon, who's superintendent of the Columbus City Schools, who is one of the most positive people and upbeat people that I get the opportunity to talk to. And I'm going to let Dr. Dixon follow up with the next question for Dr. Melnyk, and then we'll hop into the rest of the conversation before, as people say, before Bern has to jump. So Dr. Dixon, I'll let you take it from here.
Thank you. And thank you, panelists. This is an awesome discussion. And my next question, I think I can even say I have a personal reflection when we talk about heart attacks and stress. My mom was a classroom teacher who had a massive heart attack at 52 years old. And it shows how if we don't take care of our hearts and our health, and she had 4 children, they were put, and I could, we see that now during this pandemic, how stress in women have taken a toll or can take a toll. So how do we maintain heart health? What should we know about our family histories so that we are taking better care of ourselves and being able to answer those questions when we go to the doctor's office, and that list of questions about our families that some of us don't know the answers because we've not talked to our families about the history of heart health. So let's start with, who wants to start? Dr. Mehta, you want to start with that, or Dr. Melnyk?
Sure, I can answer that. Yes, heart health is so important pre-pandemic and certainly even now. For all patients, we would recommend leading a heart healthy lifestyle. And that includes the diet, following the heart healthy diet, which is balanced, and avoiding the high substance abuse that Dr. Melnyk had spoken about. Exercise is so crucial in terms of your heart health. People don't value it as much as they should. And it's been especially challenging during the pandemic of finding safe places to exercise and to exercise with a mask or not with a mask. But that's another important thing that we would say for all to try and maintain their heart health. Additionally, medications. If you're on medications for your diabetes, your high blood pressure, high cholesterol, or other things, even depression, you should be continuing them. Those are important. That's the only way we can maintain our healthy state. It's not to say that you're a failure if you're on medications, but it's our way of helping you to stay healthy. So these times are stressful, as Dr. Melnyk had said, and so there are things that you can do for your heart. In addition to the deep breathing is meditation. That can kind of bring the mind down. So the mindfulness, the yoga is another option as well, or just finding activities that you don't think are stressful for you. So the things that you enjoy doing, you want to try and enjoy, such as if you can dance at home or do sewing, things like that are also helpful to alleviate the mind, because if the mind acts up, it does lead to things related to the heart. In terms of family history, it's really crucial to understand what your family suffers from or has suffered from, because without that, you're walking kind of blind. And if you know that you have a family history of heart disease or strokes or high blood pressure or cancers, then you're going to need to pay a little bit more attention to it. And you need to pay attention at a young age. And actually, we would say even the kids that you're working with, they should start paying attention to their heart healthy lifestyles. So if you know that your family has a history of heart attacks, then you need to act upon it now. If your family has a high history of high blood pressure, cholesterol, which are silent diseases, then you need to have them checked by your physician or your nurse practitioner just to make sure that things are aligned, because they're silent and we can pick them up early and start treating them at an early stage. I do want to say that just because you have this family history that may not look so great doesn't mean that it's the end of the world for you. There are things that we can do and partner together with to improve your overall health. And so don't take it as everything's going to be inevitable. There are potentials to improve your health by taking the necessary steps.
Thank you. So by taking those steps, we can channel our energy and do something fun like yoga and exercise, and really, focus on two things while having fun. So that's good. So let's go back to Dr. Melnyk. As leaders, what organizational support should be provided to respond to stress at the employee level? How can leaders model required behavior for the entire organization?
Talisa, it's great to meet you. I want to share that we have something in common. When I was 15 years of age, home alone with my mom, she sneezed, stroked out, and died right in front of me. But what I want everybody to hear today is that my mom had been having headaches for over a year. And my dad kept saying, go to the doctor, figure out what's wrong. Well, she went to her family physician 1 week before she died, was diagnosed with high blood pressure, given a prescription for a blood pressure medication that my dad found in her purse after she died. She never took it. And that's one of the reasons I am so passionate about my wellness role and shifting our paradigm more in the way of prevention. So getting back to leaders, top leaders are so critical for their employees in terms of walking the talk, for sure, but also for creating a fabulous culture that makes it easy for people to engage in healthy behaviors. There's an old saying, culture eats strategy for breakfast, lunch, and dinner. And the thing I want to say to the leaders on the call today, as you all know, culture takes time. It's not going to change in a year or even 2. It takes consistent work. But we know through research, for an organization to be super successful in improving their population's health and well-being, you have to target evidence-based interventions to your people in the grassroots of the organization, to your managers, your supervisors, your top leaders, and you've got to fix system problems that create stress for your employees. It can't be done. We've done it successfully here at Ohio State. And I'd be happy to talk to anybody further after this webinar. But my last words today, leaders, we cannot continue to pour from an empty cup. Taking good self-care is not selfish. It's essential because we can't take good care of everybody else unless we take good self-care. Thanks so much for having me with you today. Stay well.
Thank you,
Thank
Dr.
you.
Melnyk.
Yeah, that was what she said is so important, because we as leaders, sometimes we take our own personal care for granted. I know John and I talk often about he takes time off and just goes somewhere and goes to the beach with his families because we are so afraid we may miss the work, but the work will go on without us and we have to take better care. So what an awesome quote to leave on. So let me go back to, did I go to you, Dr. Bartle-Haring? And stress has a significant impact on our family lives. So what conversations should leaders have with families and friends and family members about stress management? And what does effective communication look like?
Well, I would agree with everything that Dr. Melnyk just said in terms of taking care of yourself. But in terms of talking with others, like I can imagine superintendents and principals being, getting lots of phone calls and lots of people coming to them who are under stress. And I think what's most important, and I was thinking about this the other day for myself, is like we don't tend to give ourselves much credit that we didn't get any training to deal with life in a pandemic. You may have had critical incident training or something like that, but all that's like based on, it's a short-lived kind of crisis. So I think we need to give ourselves some credit. And if I was talking to, and when I do talk to people under a lot of stress, I talk about that. Like, what is it that you are doing well, given our certain circumstances, our current circumstances? So I think it's important to talk about that with people as a way to manage their stress, because I think we still put lots of pressure on ourselves as we strive toward excellence. And I have no idea what excellence looks like in the time of a pandemic, but we keep putting that pressure on ourselves. I think it's important for people to understand that they need time. That, like you just talked about, like taking a break, just getting away and remembering that the world goes on even though you're not plugged in. So those are some of the things that I would talk to folks about in terms of stress management, along with what Dr. Melnyk was talking about. In terms of what effective communication looks like, I think the most important thing to remember is it's less about talking and lots more about listening. So effective communication is listening and making sure, checking it out with the other person, that you heard what it was they were trying to communicate to you. And I think what happens to us, we get into lots of trouble when we make assumptions about what the other person was trying to tell us. And we don't check those assumptions out. And then we move to like maybe trying to solve it for them when we didn't hear correctly or we didn't know what it was that they were trying to tell us. So I hope that makes sense, that making assumptions about what the other person is trying to tell you, coming up with what it is you want to say while they're talking, it probably doesn't work very well. So effective communication is a lot of listening and not necessarily trying to fix it right away. So I know that especially as leaders, we might get into that mind frame that they're coming to us because they want us to fix it, when in fact, maybe they're coming to us, or what's going to help the most is that they have a chance to vent, to talk about what's going on.
Yeah, that's a good point. I even find myself as a leader being more vulnerable now and just listening, because I don't know what to say. And I find myself getting emotional because I think we sometimes want to be fixers, right? And we want to fix everyone's problem because we think we should as a leader. And I think this pandemic has shown us is that, we need to listen and they need to be heard more than ever. So you're right, just taking that time and just listening, not judging, just allowing people to share their experiences helps them. And what I've found as a leader is helping me. It's helping me in more ways than I thought. So thank you for that. Thank you for that reminder. So let's go to you, back to you, Dr. Mehta. And when we look at as a specialist in women's cardiovascular health, does stress impact women differently? And are there specific signs or symptoms women need to look for?
Sure, that's a good question. I think stress impacts both genders. It's not gender neutral. We do need to understand that women do tend to suffer more from depression and anxiety. So on top of that, adding the higher stress can kind of tip them over into more crisis state. But the symptoms that Dr. Melnyk had said apply to both genders. I would say that at this point, though, with the pandemic, the issues that we're running into is that, you know, there are more women that are now playing triple role, and they are doing their job, they're being mother, and now they're also being educator for their children. And so that's added a lot of stress. I know when I've had to educate my kids, when we've traveled, it's not fun. It's not vacation anymore. And so I think that's been the higher stress levels that our community is noticing. And I want to be specific that it's not just for women, though. In this pandemic, I have many colleagues who are males that are also being educator and doing this. So we're all pulled in different directions. So it's not necessarily gender neutral. What we do notice, though, I've noticed in my patients is that more patients are coming in complaining of their heart fluttering, and they're having a hard time sleeping at night. And so those are things that they may notice, or it's this pounding sensation. I can't lay in bed without my heart pounding, and now I'm scared about that on top of everything else. And that makes it kind of challenging for these patients. Additionally, one of the things that we know in women's heart health, especially like when women come in with heart attacks or things like that, is they come in later, they present later. So they either ignore their symptoms, or they decide that they need to, you know, they've got other things to do. They need to make dinner or do other things and delay seeking treatment. And that's what we're noticing in our females population as well, is that they're delaying the anxiety and the stress levels, and they're kind of ignoring those symptoms and still trying to be Superwoman or Wonder Woman, and it's just not working, and that can be problematic. The other issue is the guilty feeling that was brought up. You know, when you take time off for yourself, you feel guilty. So going on those vacations, you feel guilty. And it's hard to like decompress and stay away from your emails and other things. And that's something that, you know, you really need to learn how to do. And I struggle with that too, but I'll say this winter, I did that for the first time, didn't really log into patient stuff. I had other colleagues that I trusted could do it. And it was really refreshing to actually take that time fully to kind of decompress. And it makes all the difference when you do that. But we also feel guilty taking time to even exercise, right? Because like I should be doing something else. And that is so important. If we're talking about stress management, before taking a pill or anything, is really exercise helps. And it kind of can decompress the brain. It makes you think of things. I don't know if it's that extra blood flow that's going to your brain, but I can solve problems a little bit better or come up with presentations or other ideas better when I'm on my bike exercising. So that extra blood flow is essential. So to summarize, is stress different in men than women? No, I think we all adapt to stress differently. But women do tend to ignore their symptoms or their stress levels, and that can be problematic.
Yeah, thank you. And I think you're right. We do that. We think it's just something normal and we ignore it, but we cannot. So all the women who are listening, we cannot ignore those symptoms. Take some time and let's exercise and make sure we're taking care of ourselves. So Doctor, we go back to you. Suzanne, when we think about our students, right, as superintendents, we always say that our students spend more time with us than they do at home. But that was prior to the pandemic. So now we're thinking students had stress with, being in the classrooms and managing grades and friendships. Now they're home and they're spending more time at home with their families and away from their friends. And in some school districts, they are getting some opportunity to visit with their friends and their teachers. So how should students, we think about students managing that stress at home, and how should parents talk with their children about stress?
I think, I don't know about the physical aspects of stress. I mean, that one you'll have to talk to Dr. Mehta about, but I think kids are aware of the stress in their environment as well as their own levels of stress. And so I think you have to pay attention to both of those. So talking to kids about their own stress, depending on their age, obviously you need to use words that they're going to understand. So stress might not be it. I mean, it might be that you kind of feel on edge, or you kind of feel like you're not sure what to do next. Some things like that you want to talk to them about. And then I would give kids the same sort of pep talk that we've already had, like, let's get outside and do something fun, or, take a break from what you're trying to do to relax a little bit. So I think kids respond to stress in very similar ways. But when kids respond to the stress in the environment, they may not be aware that that's what they're doing, right? So they may be acting out in particular ways. So I think, especially when parents are at home trying to work as well as educate their kids, parents are under a lot of stress. Kids are going to pick up on that. And so I think it'd be really important for parents to be able to talk to kids about that. And again, depending on their age, using words that they'll understand. But I think it's important, just like it is for you as leaders of an organization, to be able to say, you know what, this is hard for everybody. I think parents need to be able to say that to their kids, that this is, I'm going through, this is really hard. No one knows what to do, and making sure kids know that it's not them, that the stress is not about them, but about the situation. Or if it is about them, it's not them as people, but their behavior is making them people a little crazy right now. I mean, those kinds of ideas.
Yeah, thank you. I know that we've seen families want input on what to do, and us as leaders, leaders want to know what to do and some things that we can do to make sure that we're healthy mentally and physically, and that we're having those honest conversations with our peers, with our employees, and also with our families. So thank you. I know Dr. Marschhausen. John, do you have another question you want to ask?
Yeah, I know Dr. Melnyk mentioned some of the times people turn to alcohol as a way to mitigate stress. What is that impact on us physically? And I'll start with you, Dr. Mehta, because I also know it has an impact on family life that Suzanne probably can talk about. But what does that do for us if our response to stress is pouring a glass of scotch when we walk in the house after a hard day?
Yeah, I mean, that's a problem, and especially a lot of people are working from home, so that one scotch can be 5 scotches, right? And that's entirely problematic. It's people somehow seem to think that that's a stress reliever, but it can actually worsen depression. It can be downing on you, but it has a lot of toxic effects on the body, as well as you all probably know from liver disease. But there's actually something that's what we call holiday heart. So around the holiday times, people tend to drink more alcohol. And when they do that, it can lead to atrial fibrillation, which is an abnormal rhythm of the heart, which then can sometimes lead to strokes. And so now that alcohol usage can be quite detrimental to the overall health. So I would say that that alcohol is not a stress reliever as people like to think. And I think that's a kind of a cultural thing that everyone seems to say, let's just talk over this over a glass of wine, or I just need to have that glass of wine. But it isn't. And I think culturally we need to change the conversation to let's go take a jog and talk it out, right? That would be, and now I think I'm going to get all negative hate mail from everyone on here for saying that. But I mean, that's the reality of it is that it isn't good for you, and it changes the dynamics at home as well, but also your function at work. One of the things that I do want to mention on a side note is that we all react to stress differently, and we also react to news differently. So if you are seeing someone stressed, I think you should bring it up to them, right? Or bring it up to a close friend of theirs. We shouldn't shy away from it. So if you see something, say something is very important for the children, but even for your colleagues, because these are unusual times, and we need to recognize that.
You know, I might be able to go for a jog with you, but some of our colleagues probably could just go for a walk together. And a walk at lunch is probably meets the same goal. Isn't that correct?
Yes, just movement, and the movement should not be from the hand to the mouth.
Yeah. Suzanne, do you have anything to add as our first panel starts to wrap up?
I would just say, when it comes to substances, not just alcohol, but any substances, that's definitely going to have an impact on the family at home. What it winds up doing is you wind up distancing yourself from the family, and your family gets that, and they rearrange themselves in ways that may or may not be good for them. And typically it's how they rearrange themselves is not good for them or you. So I would pay attention to that, definitely. But I think Dr. Melnyk talked about overeating and all those things. So as we tend to not be able to handle our emotions, we do lots of other things that aren't very good for us.
Yeah, it's all about that work-life balance. It's all about being able to, yeah, it's okay to have that dessert every once in a while, but if the dessert becomes your coping mechanism, that's a problem.
Right.
It's probably okay to have a glass of wine every once in a while, but if that's your coping mechanism, then we got a problem.
Right.
I think most doctors would say you got to have life in moderation.
Absolutely.
Well, I would like to thank both of you and Dr. Melnyk for joining us, and Dr. Dixon, thank you for taking time out of your day to join us. So appreciate all of you being here. And now is the time that we will transition to our second panel. So if anybody have any quick parting words as we sign off.
Yeah, I just want to say thank you to you. This has been awesome, even for me. And it's just, I've learned so much from both of you, all three of you. So thank you so much for joining us. And I was honored to be able to facilitate this session. So thank you.
Thanks for having me. Thanks.
And thank you for having me, and thank you for highlighting stress and the heart. It's a very important topic, and we will get through this. We have to, and we will. It's just got to maintain a strong body and mind as well. Thank you.
Thank you.
Thank you so much.